Amputation stump. Amputation can be end-bearing, where the weight is taken by the body, non-end-bearing, where the weight is taken by the joint, guillotine amputation, where the stump is kept open, formal amputation, where the stump is closed. What is an ideal stump? An ideal stump is the one which should have an ideal length for proper fitting of prosthesis. It should be conical and round. It should not be tender. It should have adequate muscle padding. It should have adequate blood supply so that it heals post-operatively. It should not have soft tissue hanging. The skin and scar should not be adhered to the underlying tissue. The level of amputation depends on the extent of the disease and functioning of the remaining stump. Different types of incisions. The first one is racket incision, which is used for digits and toes. Oval incision, which is done for metatarsal amputation. Circular incision, done in case of guillotine amputation. U-shaped incision in case of above knee, that is AK, and below knee, BK, amputation. 10 principles of amputation stump. Mark the incision, drain the cavity with a suction, avoid tourniquet, ensure blood supply to the flaps, ligate the blood vessels, use absorbable sutures to unite the muscle ends, do not clamp the nerves, give a conical stump, saw the anterior part of the bone. Give antibiotics. Indications of amputation. So D, and D. Dead limb, deformed limb, deadly limb. Dead limb is when part of the bone is destroyed by disease, deformed limb, and the deadly limb is when the patient's life is threatened due to the spread of infection. Complications of amputation. Wound infection, which is seen in diabetic gangrene cases, flap necrosis due to decreased blood supply, stump ulcers, seen during initial stages of wearing artificial limbs, contractures when the artificial limb is not well fitted, amputation neuroma, end of the nerve is entrapped in scar and gives pain, phantom limb, sensation of presence of missing limb, which is usually painful. Now let's see the levels of amputation. In the upper limb, forequarter amputation, shoulder disarticulation, transhumeral amputation, elbow disarticulation, transradial or below elbow amputation, wrist disarticulation, transmetacarpal amputation. In the lower limb, hemipelvectomy, hip disarticulation, transfemoral amputation or above knee amputation, knee disarticulation, transtibial or below knee amputation. Krukenberg's amputation is a gap which is created between radius and ulna like a claw to hold objects. Amputation of toe with the head of metatarsal. Transmetatarsal or gills amputation is when multiple toes are involved. Lisfranc amputation or tarsometatarsal amputation involves cuneiform, cuboid and the metatarsals. Chopart or the mid-tarsal amputation includes talonavicular and calcaneocuboid. Symes amputation is at the ankle joint when the heel pad is preserved. Pirgoff's amputation is a modification of Symes amputation. and the calcaneum is retained.